Many times, if it is a small stone, we like to allow patients to pass them. That's usually our first preference. When a stone is large or when a patient's unable to pass, there's 3 or 4 different treatment options. One of the most common treatment options is something called lithotripsy. Lithotripsy involves using electromagnetic waves to sort of pulverize the stone into dust. It is technically a surgery, but it involves no incisions or probing of the body. It is probably the most popular type of kidney stone surgery. It is an outpatient procedure, and the recovery is pretty quick. Most folks are back to work within a couple of days. The main recovery is usually a little bit of a backache for a day or 2. The second treatment option for kidney stones is using a telescope to go into the bladder and then into the ureter or the kidney and removing the stone with the telescope. It often utilizes a laser to break up the stone into small pieces, and then we use a basket to then pluck out the pieces. That is also an outpatient surgery. The recovery is also quite quick and also offers excellent results. That is called ureteroscopy. When stones get larger, then the options for treating kidney stones usually involve inpatient procedures. The major treatment option for the treatment of large stones, and large is defined as something larger than about 1.5 centimeters or ½ inch. Those usually require something called a percutaneous nephrolithotomy. That involves a small, tiny incision on your back, only about 1 centimeter. We then go in through your back with a telescope. We then again use lasers and also ultrasound technology to crush a stone into dust, and then we suck the dust out. That's also, it is an overnight stay in the hospital, but majority of the patients do quite well. That area has been revolutionized in the last 10 years, where it used to be for large stones, people used to get large incisions and would often stay 4 or 5 days in the hospital to treat kidney stones. We can now do these large stones with much smaller incisions and a much quicker recovery. Most of these individuals who have these larger stones can really get back to work in a week.